Hi, I'm Lisa Dumkow. I'm an Infectious Diseases Pharmacist Specialist at Trinity Health Hospital in Grand Rapids, Michigan. I'm also the President-elect for the Society of Infectious Diseases Pharmacists. The Society of Infectious Diseases Pharmacists and the Society for Healthcare Epidemiology of America have launched a joint survey to assess clinicians' perceptions of outpatient antimicrobial stewardship practice and research needs. I would encourage everyone to take this survey. We're really looking broadly to get people's opinions, whether or not you practice in outpatient antimicrobial stewardship. There's a huge area of need for practice perceptions and future research. And so we're looking to get broadly everyone's opinion on how we should practice going forward and what our research needs are. So our meeting focuses a lot on antimicrobial development and antimicrobial resistance, and you'll see that throughout the meeting, even in terms of the keynote that we had this morning from Dr. Karen Bush, which was phenomenal just on the history of beta-lactamase production and the antibiotics that work against those. In terms of translating the history to today's clinical practice, you'll see a lot of that at the meeting as well. So we've got some really great industry-sponsored talks focused on antibiotic development, as well as new pipeline agents, and then also a lot focused on diagnostic stewardship. And you can catch a lot of those in the poster hall for our presenters who are presenting late-breaking research. Antimicrobial stewardship implementation and implementation science has been a hot topic at the meeting as well. And as a frontline practicing steward, I think I can safely say that the hurdles that we encounter are different at each site, but are somewhat similar amongst stewards. So I think in the current political climate and with the way that payment is going in healthcare right now, resources are probably the biggest hurdle that a lot of us are facing right now. So just being stretched thin in terms of time and FTE support for antimicrobial stewardship. We had a phenomenal presentation in our SIDP business meeting this morning from Brad Langford and Amy Kang on the stewardship staffing calculator, or SPARC, that they're developing, really looking at what our current state of staffing, and then how do we apply that to optimal state of staffing. And we're not quite there yet, but that will hopefully inform a lot of us in terms of the FTE support that we need to support optimal stewardship programs in order to optimally care for our patients. So I think that's probably the biggest hurdle that people have. So the gram-negative pipeline continues to expand and explode. And again, I think Karen Bush did a wonderful job of giving us the history on this at the keynote session today at the meeting. And we've got actually another wonderful talk on Sunday talking about the rise of metallo-beta-lactamases. And so you can see the huge need for the gram-negative pipeline to continue expanding. So it does become very difficult and tricky for clinicians to work through. I know my own providers have said there's so many drugs, like how do I know which one to use? And so hospitals and stewardship programs really need to be organized in terms of making guidelines for when they want to use one agent over the other. So they do all typically have like a niche role in therapy, whether it's KPC or metallo-beta-lactamases, and which one you might use first or second. Drug-resistant Acinetobacter, drug-resistant Pseudomonas. So they're targeting different pathogens. And again, we need to be cognizant as stewards to build these guidelines and pathways to help our providers and our teams navigate which one is the most optimal to use when. We also need to work with our microbiology labs in terms of like diagnostics and making sure that we're able to identify the different resistance patterns so that we can optimally use these agents in a timely fashion when they're needed for our patients. And so we're not waiting to optimize the use of these agents. So when antimicrobial agents come to market, they're typically coming for a few indications. So like pneumonia or Hep/VAP, skin and soft tissue infections, or urinary tract infections. And I would say those three are like the classic three that drugs are getting approved for in both the gram-positive and the gram-negative space. Some of that has to do with just the approval process and the way that medications go through the FDA, and some of those being the easiest or more clear-cut in terms of how they get approved. I will just say, once these novel compounds typically get approved, clinicians on the other side at the bedside are really using them for everything, so not necessarily the indication that they're just approved for. So let's say an agent gets approved for Hep/VAP, but your patient actually has bacteremia and maybe it's from a skin and soft tissue source. Once it's approved for that indication and maybe we don't have another agent to really target that gram-negative pathogen, Clinicians feel, I think, pretty typically comfortable applying it to a separate disease state as long as the pharmacokinetics make sense for that disease state. And, a lot of times we are leaning on some of our industry colleagues to help answer those questions before applying that to a patient. But that's holistically like the why certain drugs get approved for a specific indication. A lot of it just has to do with how easy is it to get it down the pipeline for the FDA to review it. At the President's welcome this morning, Dr. Erin McCreary and Dr. Mike Ryback announced the new name for the meeting going forward, which is the Antimicrobials meeting, which will be brought to you by the MAD-ID and SIDP societies. Next year, the meeting is located in Baltimore, Maryland, and will be at the end of May, and we really hope that everyone can come and join us as we kick off, again, this great collaboration between our two organizations and move to a new city with a new name.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.